Okay, welcome everyone, and thank you for joining our discussion on digital therapy platforms, the next frontier in mental health accessibility. As demand for mental health support continues to grow, digital tools from virtual counseling to app-based therapies are becoming essential in our healthcare sectors. Today, with our distinguished and insightful panelists, we'll explore how these platforms are reshaping care, the opportunities they create for our community, and the challenges we must address to ensure safe, effective, and implementation for our patient, our clinician, and everyone. Please allow me to ask our panelists to introduce themselves.
Hi, my name is Dr. Kay Rubin, and I'm a licensed mental health counselor. I have my own telehealth practice that is based out of Florida, and I basically work to help individuals improve their quality of life and life satisfaction, whether they're dealing with anxiety or managing a life transition, or they want to improve their relationship satisfaction with someone that is significant to them, whether it's a significant other or a family member. And I take a very practical, collaborative approach with my clients. Thank you.
Hello, everyone. I explained many times today. Like, I hope you're not bored, but we are
We'll hear it another time.
Thank you very much. So we are Dripify, and we are making treatment, test, track, and emphasize the people, clinicians, to have more deep insights about longevity for the patients. So we are delivering digital solutions, molecular solutions, and biological solutions. So I hope it will be a good panel today. Thank you very much.
Hi, I'm Dipali Lohar, and I'm the CPO at Radin Health. And my job is to take an idea and bring it to life. And also currently, I'm also having an idea of my own, which is going to be launched soon, called Mindful Minis.
You're revealing it?
Yeah, I have already revealed. Yeah.
Hi, my name is Cheryl Damasi. I'm the Group Director Client Experience at LifeCare International Brokers. We're here in the industry for 30 years and assisting clients on insurance policies. Very recently, we've realized that health and well-being are inseparable in the insurance and healthcare world, and that's what we are fearlessly going to be spreading around in the Middle East to start with, and East Africa followed, and globally thereafter. Thank you.
Okay, great. Now, I want to say that digital therapy is often described as the future of mental health. Okay, but it comes with challenges, and the future can be risky. It might be also hopeful. In one sentence, what does digital mental health truly means to you?
I think it's gonna bridge the gap what we have right now, the accessibility. A lot of people do not have access to these mental health sessions. It gives more accessibility. That's what I can say in one line.
So, do you think this will bridge the gap? Which gap do you think it will bridge when they develop this in mind? What key gap they intend to solve?
I think based on the way those physical locations are spread across, people not tend to go regularly, and based on the busy schedule they have, it might be a rare encounters. Rather, it could become more episodic encounters and might go very regular since it will be more accessible over digital. And I also feel, based on my personal experience, a few years back I was going through a lot of physical issues in my health, with me. And during that, I was visiting one of the clinic for physiotherapy, and it was too far. And I would spend a day to go there. And during that, I realized there was a lot of emotional things as well, which needed counseling. And they were doing that as well. They said, like, why don't you try this? And I did try, and I couldn't go regularly because it was too far and had to spend a day, and it would take like 2 hours to go there and 2 hours to come back, and the wait time. And I feel if you move this to digitalization of these sessions, I guess it would save a lot of time for patients and also the healthcare people.
I'd like to add to that, if I could. In addition, I echo with you about accessibility. As a telehealth therapist, I can tell you my clients are busy, and it's hard. Sometimes many meetings are running late, but it's easy to just click a button and there's your therapist, there's your meeting. But also, I'd like to add the convenience factor, because, for example, when I have to do family therapy and one person's in a different location, or all of a sudden we realize, you know what, we need to move from individual to family therapy, but I have a family member in this state and that state, and this one is in this country, how do we do it? Well, I send them a code, and then they sign in, and we're able to do a therapy session. So it makes it convenient, number one, and two, accessible, because, hey, we're saving a lot of time, and it's convenient. So those are the two things that it means to me.
And according to me, of course, the cost factor. Digital therapy, mental health therapy is so expensive. So once you go ahead and have access to counselors and therapists online, I think the affordability aspect is a given. And why do you wait for a crisis to come in? Why do you not be able to get access to these counselors and therapists when you need it the most? So I think that's something that I want to highlight far more.
Abdullah, you want to add something?
Yes, in our platform also we have teleclinic module, so we can test our patients' stress levels. So we can add on just on the mental therapy, we can look to their heart rate variability and also their blood pressure constantly in their lifetime. So we can check their stress levels also. We don't have especially mental health section, but we can help to the therapists that he has constantly or she has constantly high stress levels in specific daytime or specific moments when they go to work, when they are driving the car, when they have some fears. So we can just help like this, but we don't have especially mental health section, but we must have, as I feel.
Okay, so Dr. K, you said that you do this from state to state.
I'm in my state, but if a client happens to be in another state visiting, they can still see me.
Online.
Mine is online.
Yeah.
Through a secure platform.
Yeah. Did you notice any change in emotions for the patient when they move from the screen, from the face-to-face to the screen?
I mean, it all is all about rapport. If a client feels they can connect with you, it doesn't matter whether it's face-to-face or in person. It doesn't matter whether it's in person or whether it's digital, right? As long as the connection and rapport is there, it really just depends on personal preference. I don't see a difference. My clients don't see a difference because the most important thing is there, which is rapport and connection. The only times I would say where it's not a good idea is if it's a severe condition like very severe anxiety where they need to do in-person things like systematic desensitization, exposure therapy, or for kids with to do play therapy, I would recommend only in person. So that's the only times I would see that difference.
Yeah. Abdullah, you said that you don't have that service, but it's worth to look at it.
Yeah, of course.
Right? So let me ask you, in your opinion, what will stop or what is the barrier clinician or developers will not go deeply into implementing such platforms in their practice? Is it the culture, it is the cost, or it's any other factor that will stop people from investing in such platforms?
I think it's like the longevity. The people are used to have one-on-one sessions, and and after Corona, they are more used to have like Zoom sessions and online sessions. And if they build a trust one-on-one, then they can continue with the Zoom, as I think. In your experience, I don't know, but if you start with directly from the Zoom or like online sessions, I think the patient has a lack of trust or lack of experience. It's my opinion, but you are more expert. And starting directly online or starting one-on-one, then switching to online, is like affecting, or how you think?
I don't find it that way. I mean, when I had my clients, I have a college student client. I started out with her when she was college, and she did it in person, and she switched to telehealth. I think that they're getting so used to it because of the technology we already have.
Yeah.
People are now making phone calls on video. So
Yeah, exactly.
whether I'm spending a video time with you, like we did during Corona, or I'm in person with you for coffee, I'm used to it.
But without the one-on-one experience, like directly starting with the online, it's works the same without seeing the person.
What do you mean it works the same?
Yeah, for example, the person never came face to face to you, just starting with the online.
Yeah, all my clients, I've been doing telehealth for the last 6 years almost.
Without
I've never met any of them in person.
Ah, perfect.
Unless it was like incidental contacts, like because I live in the same area. But other than that, I've never met any of them. Only met one in person, but that was like after 2 years of working with her. So I think the fact that we're so used to it, we had the coronavirus get used to us doing Zoom.
Yeah.
We're using digital phones. We got used to it. So I'm not finding much of a difference to them. It's the same thing. I'm meeting with my therapist.
Like I said, it's like a longevity. The doctors and the experience must be taught for this. So as a school medicine type person, I'm switching to longevity, like last 10 years almost. About the digital therapies, it's almost I need, like you said.
Yeah.
So I'm still thinking that first one-on-one, then to change it. But as your experience with a lot of patients, you don't need one-on-one.
I don't need it, but it also depends on personal preference, because I will have someone call me and they'll say, I really want someone in person, and I said, do you want to try a session with me digitally? And then they're because the rapport is there, they feel comfortable, they're ready to continue sessions.
Perfect.
And then some are just a hard no. I really need to see you in person. So personal preference, but I've been doing it for 6 years.
Mostly like.
And all the clients I have only met one in person, and that was incidental contact.
Wow.
I do have a question for Dr. K, if you allow me, Lena. So in your career, have you encountered any patient that needed immediately sent to hospital during your online session?
No, not yet, but I am prepared for that, because that's one of the concerns that does happen, especially if there's suicidal ideation.
Right.
And we do a suicidal risk assessment. We already have their contact information. So whether I'm in person or whether I'm digitally, I'm still going to follow the same protocol. I'm going to keep them on the session. I have the number for 911, their address. So as I have them, I can make that phone call with them there. So we're prepared for those situations when they do arise.
Right. I just want to build onto it, Dr. K and Rupali, is that remember, as an insurance brokerage, we do provide this benefit to clients. And when the benefit is provided, we have to ensure that along with the online access and capabilities, there is a referral to an on-site doctor.
Yeah.
And I think that's key, because if you lose out that momentum about passing on the patient over to an on-site practitioner, right, that the hybrid model is crucial over there. To have access to both.
It is crucial, but we also have 24/7 crisis mobility, where we can call that number and they can go there and provide the services on site.
Yeah.
So we're not leaving anything hanging. We already have protocols for emergency situations that we have to follow by our ethical guidelines, because we have to provide the best care for our clients.
Absolutely.
Sorry, is it like multilingual or just English?
I speak English.
But
I'm from South Florida, so we're very multilingual.
Yeah.
So we've got people that are speaking Spanish and English, Hebrew in English, Russian in English.
If you have German, we can apply it
We
directly.
can make it happen. We can make it happen. But you know what, though? Even if there is a language barrier, with the technology that we do have, you can, with Google Speak, you can speak it in English, and then it has the voice in German. So we don't have that linguistic barrier. The only problem is if there isn't Wi-Fi, we might be a little bit in trouble.
Correct.
So, Cheryl, I will continue with you.
Okay.
And the next question, how can digital mental health platforms move beyond crisis response and truly support long-term well-being, continuity of care, and measurable patient outcomes?
I think to make sure that there's continuity of care, like I mentioned earlier, is the accessible and the access to on-site well-being therapist. And what we've realized is that everyone's so different from the other, that today someone prefers to not be exposed and meet someone in person. But there are people, especially the younger generation and Gen Zs, who completely love and are so comfortable with the digital access of accessibility. So we must provide access to people based on their preferences. And I think that's the most important piece when you're providing a service, to ensure there's inclusivity of people and they prefer the way they like to be counseled and taken care of. Another very important piece is that very recently we've been exposed to life coaching. And I think besides, there is a taboo, of course, and it's a given. And I think everyone in this room over here realizes, based on cultures, there's a taboo in accepting this. To say that I have a mental problem is a turmoil in its own way and a judgment in its own way. Leave alone that aspect of it. The acceptance after COVID has become so much more supportive. So I think that's an important piece that we have to thank the outbreak of COVID to accept this kind of outcome.
So do you think digital therapy reduces the stigma around how people view mental health support?
I think there's a nice barrier.
Why not?
Yeah, I think there's a nice barrier come up to say that you're not seen probably in a mental health clinic. There's nothing wrong in it, and I'm a big believer of going and getting mental health. But also the barrier has come in, and you can go ahead and do it digitally.
I would like to add to that. I see, I come from a community, it's a stigma, taboo. I feel like people are shy to go visit such clinic, but if we give this a digital platform, they're a little bit confident going there and having a counseling session rather than physically visiting those clinics.
I want to add to what you're saying, because it's hard enough to say that, hey, I need help, right? Even though it's becoming more and more destigmatized. But yes, I have, in addition to I have the anonymity of doing it on my phone or on my computer. I also, we're using apps for everything. We're using apps for fitness. Now this is becoming more normalized. I'm using my app, my mental health app. Mental health is now becoming part of the conversation in our day-to-day society. This is good for my mental health. This isn't good for my mental health. Here's my mental health app, So it's becoming a little bit more, I guess, in a sense, normalized. And also I have the privacy factor.
So how do you ensure or how patients can trust that this app or this digital platform is ethical, their data is protected, and they can trust and use it?
So what I do with mine is, mine is HIPAA compliant. It's a secure platform. I'm providing them with, there's transparency in the beginning. So I'm providing them with consent forms regarding the services they're going to receive, how they're going to receive it, why it's considered a secure platform, and documentation of that. So that's how I get around it, and that's what I do.
Can I ask something? Are you recording also, or just?
I record with consent from the client. Mm-hmm. So I do it for two reasons. One is note-taking takes forever. I like to have balance in my life. And I find with the AI, Gemini transcription, it does a way better job than I would ever do. And I tell my clients that, and I ask them, are they open to that? They have to sign a signature. If they don't, then I'm writing my notes by hand. The other thing is I'm also working towards becoming a Gottman certified therapist. So part of that means I need to record my sessions for the Institute to review them to make sure that I'm showing proficiency. And if they sign a document and a release for that, then that happens. But they also have the option to say, hey, I know I gave my release, but I don't want my sessions transcribed. I don't want them recorded anymore. And then it doesn't happen anymore.
They have the choice. They
have
can
a choice.
choose, which is good. And
Yeah. And just to build on Dr. Lina, is that remember from an insurance and health and well-being side, a GDPR certification, licensed practitioners, border privacy, and cross-border privacy. I think all of these things are crucial. So from an insurance perspective, we would never work with a partner that doesn't meet all these criteria and requirements. So that's a given.
Okay, great. So now, from your experience or from your knowledge into this topic, where do you see the challenge in adopting the technology or the trust from the patient? So where is the issue in progressing further in digital platforms? It is doctors to adopt it, to believe in it, or the patient to trust these platforms?
I think from my experience, it's the problem with the doctor's side, because patient can be very good diverted into the true way that they can get true help, but the doctors are not very flexible to use such technologies in their practice if they are not open to the such things. It's my experience, but what about your experience? I don't know.
I mean, my experience is as long as the client's open, they're open.
Well,
So
clients are open,
I
but the
don't-
doctors are closed.
I don't have that problem because the practice I have is telehealth. The group practice that I work for is telehealth. Some practices are very traditional, and this is the way we've been doing it. But some are also offering hybrid because they're seeing it's a way to retain clients, you know? Because at the end of the day, we have to do what's in the best interest of our client to basically support their needs. And if telehealth is the way to go for it, then we're going to incorporate it.
How much % can be like a hybrid? How much of them is like a classical one? If you like.
I don't have the exact numbers.
Of course, but from your experience, like.
But in my experience, I have yet to see one that's just a purist in person. I've seen more hybrid and more solely digital.
Yeah, no, but about the society, like in America or.
I haven't really looked at, I can only
50%?
tell you about the state of Florida because I'm licensed in Florida, but it's about, either you have a purist in the fact that it's 100% digital or it's a hybrid model.
So almost transformation done.
Yeah, you're going to find very few that are only 100% in person because the demand is asking for digital because of the accessibility and the convenience for the client. And also, it's also good for the practitioner too.
Yeah, of course.
It helps me have balance in my life.
Yeah, home office.
Home office.
Okay, I was also doing some research on the same line. If we had this digital app, I noticed like we had lesser mental health workers compared to the patient because the awareness would increase and there would be more users who want to access this. I was doing more research on the numbers. I found out we have 13 healthcare workers against 1 million people. So we would fall short of those therapists. So this I was also doing for my app, which also talks about mental health. My app was more on prevention, and I wanted to know why this holds place right now. But I think research would also help us to identify what are the challenges if that app comes live, digital therapy app.
Yeah, indeed, after COVID, we noticed a rise in the online consultation for internal medicine, for kind of ops and gynaes patient. But I get a lot of questions from hospital during my consultancy work. Is it worth it to invest in a digital mental health app or other digital platform? Is it worth it to invest in this? And I always think it is difficult question to answer. It depends where you are living, the community, how the people will perceive this app. Do they trust? It's challenging, I think, and it varies from country to country. I don't know if you agree on this.
I think there's no other chance that they need to transform. If they don't transform themselves, like you see in Florida, they will be erased from the market, or the healthcare providers list. If they don't change themselves, they need to change their job. I think, from my opinion, there's no.
No, I agree with you. It kind of parallels, those that had, a landline. Now everyone, and then we're like, no, I'm not going to do a cell phone. And now, who doesn't have a cell phone?
Absolutely.
Right. So I mean, it's just becoming like the norm now.
Yeah.
Resistance will be broken. Yeah.
When people hear about AI in mental health, they get excited, and also they have this trust or fear issue. In your opinion, until now, at that day, what the technology provide us as a safe, or where we should worry or not trust those application or those digital platforms?
So I could take that. So in fact, a lot of clients of ours do ask us this question that, first of all, it's all human-led. So from an insurance perspective, when we pass on a client to a digital therapist, and when we call it a digital therapist, it's not an AI-generated therapist, because we worry about the hallucination of that therapist. So when we provide digital mental health access, it's a human-centered approach where there is a human psychologist or a therapist or a counselor offering the consultation, right? And definitely not an AI therapist. Not that I'm undermining an AI therapist, but you would worry for mental health advice that goes out from an AI. We could leave that for probably the last development to come up, in my opinion.
Yeah, I agree with you there, because you can use AI as a guide, but I wouldn't depend on it. There's a difference between with the professional and with the AI.
Oh, absolutely.
So, from a development perspective, whenever we think of launching any application, we always see the KPIs like how many downloads. But in this case, I feel like number of downloads shouldn't be equivalent to how well this app is.
Yeah, exactly.
I think there should be a better story to tell how many lives this application changed.
Obviously.
Those are the KPIs which we should consider for the reputation of the app.
Okay, do you see digital therapy as a replacement for traditional therapy or as long-term hybrid model?
In my opinion, it should be hybrid just to begin with, because like she said, AI can hallucinate, or there could be some gaps. It's not just AI as well, maybe operational, simple process of onboarding users, all those, and simple screening things could be online. And then if there are like some critical cases, it should move to clinic.
Yeah.
I agree in the sense that it's important to have a hybrid model. One for preference, because some people are just still,
Correct.
I like in person, but the other thing is for critical conditions, or even like, for example, with kids for play therapy, I definitely would prefer, and I find it more effective to do it in person.
And I think from my perspective, if outcomes can't be measured, right, and you can't have it to be credible, scalable, or sustainable. So I think the most important thing is that irrespective whether you're following your traditional models of counseling and therapy, or you're doing it digitally, I think it has to have a outcome measurement and scalability. Yeah.
So,
Okay, no, I in the sense that it's very important to know, are the services that you're providing effective, right?
That's right.
So, there's so many ways to do that. One is to check in with the clients when you set goals with your clients, to look at the efficacy, to review the goals. It's really important to do progress monitoring as you go in any field, but also especially in this field, because we're promoting human change, empowering clients to have better health and better mental health.
So in your opinion, which clients or which patient do still need face-to-face consultation or treatment?
I mean, in my opinion, is for those that are very firm, like I can only do in person, I can only relate to in person, then I'm not going to fight them on that. Then that's what's in the best interest for you. So please contact your insurance company or look through Psychology Today to find the right therapist. For kids, I definitely recommend in person because it's a better rapport for them. Also, to do things like play therapy is better in person than it would be over telehealth. If there's a severe condition, so for example, someone is dealing with severe anxiety and they need in-person treatment, such as doing exposures therapy, systematic desensitization, that's going to be better in person. If someone is not digitally proficient and they're having anxiety about doing that, then in person is the way to go. So it's basically person preference and also the severity of the condition.
So I think for the next coming years, it will be a hybrid model.
Yeah,
Still,
I don't think the
continue
hybrid
to
model is going
model.
anywhere.
It will not go anywhere.
And it needs to stay.
Yeah.
It needs to stay because as we've discussed, we see both situations where it's beneficial for it to be digital and also very beneficial for it to be in person. It's kind of the saying, don't throw out the baby with the bathwater. You need both.
In fact, I want to build on it that the sad part is that these benefits are highly available for your executive team and your high-level team and your ultra-high network individuals. And we forget about it that individuals that are frontline work staff, right, or mid-management probably need it far more. And they're just not educated enough to go and address and have those benefits available to them. So I think governments, organizations at every level possible has to make it accessible. And the main concept is click and brick, to have a hybrid model from both ways.
Good, good. When I was looking at your profiles and who is with whom I am sharing the floor today, I enjoyed and I appreciate a lot that each one of you come from a different background, so which give the conversation different taste. So now to close, because I want to leave some time for the audience to ask some questions, I would like to hear an advice from each one of you. What would you give the healthcare leaders considering adopting digital therapy solutions? One advice you give to the healthcare leaders if they want to adopt digital healthcare solution, either in mental health or in other speciality.
Can I go first? I've seen a lot of businesses which moves to digitalization. They lose the personal touch and curation. I feel like no matter how good this app is, we should keep human care at the core and also have like curated content, or whether it's therapy for patients.
I would say be curious in how you can maintain quality care. You know, the key thing is collaboration, empathy, compassion, rapport, ethically sound care, and how you can do that digitally.
That's a
And I
great
think from my perspective,
advice.
definitely it's outcome measurement and connecting dots to your client journeys. I think the client journeys today are so fragmented and they don't speak to each other. So I think the most important thing to every healthcare, whether it's a regulator or whether it's the end user, is to ensure that the client journeys are connected and there are data measurable outcomes.
Perfect. I was thinking the same, and I'm saying to the healthcare providers, and starting from the medical school, let's follow the demands of the society, and let's start the change from the medical school of doctors and other professions to adopt digital from the early age, that they are 18, 19 years old. When they enter to the medical school, they need to be prepared after 10 years to be adopted in their practice, daily practice, digitalized AI and other measurable things together. I think we need to start from the beginning. Thank you very much.
Yeah, it's very good. Actually, as the healthcare sector is complex and continue to evolve quickly and very fast, we need to catch up with this advancement. And it's really, it was my pleasure to share the floor with you and discuss this topic with you. And now to the audience, if anyone has some question, please go ahead.
Wow, we have 3 questions.
Yeah, we have time, so don't worry.
I'll just keep it short. Thank you so much. I think this has been an amazing panel. We have the provider, the payer, and the tech together sitting on the same stage.
Yeah,
It normally doesn't happen.
As I
so-
said, I was.
So it's really good, and I'm glad that people are agreeing to it. So my first question, if you really think of it in terms of the therapy and mental health, you've spoken about it's a big taboo, and still remains. But I still feel that it's opened up quite a bit. But do you feel it's still a rich people's disease? And we haven't really touched the rural part. So as a peer and a provider and esteemed panel out there, what are the plans in terms of really outreaching to people who really not only educated, but take the rich out and, go to the rural? How do we kind of go ahead and spread that out?
Yeah, I would like to take that question. And in fact, we are in the industry for the past 30 years, and I personally am in the industry for the past 15 years. And I've realized that the wealthier and the executive level speak openly about it. And they even have an inclusion of this benefit in their healthcare benefit, right?
Yeah.
But the fact that now it's digitally available has been able to get the affordability factor to be offered to the other segments of society. And now that is the one that's going to open up. But I think a lot of education and awareness is important. And who plays the most important role over here is 100% a top-down culture. If you're not educating the top to go ahead and support the mid-management and the frontline workers, to let them know that it's acceptable to speak about this and go ahead and do it, that's the main thing. So you're right about the fact of your analysis of saying it is probably only meant for the higher up there, right? But of course, everyone faces it.
I'd like to add to what you're saying. So, one of the key things is that mental health is becoming less and less stigmatized.
Yeah.
And also the key to that has been awareness and resources provided, and also even the media is getting into it, especially in the States, constant ads, BetterHelp, all these digital platforms. And as a result, regardless of income level and education, individuals are moving forward to becoming clients. As a college professor myself, I have a dual career. My students share with me that they have a therapist. And even the school provides digital therapy and in-person therapy. So we're not seeing a gap. It's an everybody issue, and everyone could, have mental health support and could benefit from mental health support, because we have good days and bad days.
Can I add something? Because you asked about the cost of the procedure also. I think the cost of the procedure depends on the person's hourly rate. For example, the dear professor is here, and even it's in digital, even it's in normal, the cost to the patient remains a little bit up and down, but it's also so much. So we cannot, when we digitalize it, we cannot reduce the cost so much. So his question is a little bit addressed to the AI optimization also, because if it will not be an AI force into this digital health therapy, then the costs will remain the same.
Well, here's the thing. I think it just depends on where you live. For example, in America, we have insurance, right?
Yeah,
so
of course.
You have a copay, so it really doesn't matter. So right there, some clinicians take private pay, no problem. I'll find one that takes my insurance. If you don't have insurance, well, there's a mental health clinic, and now they're offering hybrid models. They'll do sliding scale. So it's accessible to everyone regardless of income level. In the States. I don't know how. I can only say where I live. I don't know.
I want to add that in some societies and some communities, it's still a taboo. It's still not accepted, and the prices are very high. It is limited to certain level of people, and I think creating awareness play a huge role, starting from the school to the family, to the universities. I think this will work better, and the acceptance also. When, for example, now in the area I live, most of the schools, they have counselor. Whenever there is an issue with a child, they are highlighting to the parents, and there are a lot of parents, they are not accepting the fact, and they are still rejecting going to seek not diagnosis, at check-up. Yes, professional healthcare person to diagnose or to guide or to tell them what is the problem. So it depends on the society, on the community, on the places we come from, and the education level of the people we are surrounded by.
Thank you so much. Dr. K, thank you so much.
You're very welcome.
And I think there is a prior authorization issue with behavioral health within the entire payer industry in US. My second question, again, very short, and I want to give everyone time. If you look at the efficacy of mental health, do you still feel that, or if you have to measure the efficacy, would you see in-person is more efficient than digital?
I would say it's not a fair question. It really just depends on the client. And if the client is able to have a connection and rapport, and they feel safe, and they are dedicated to therapy, then you're going to have improved outcomes. I wouldn't be focused on the modality. I would be focused more on, the connection that the patient or client has with the provider and the provider's skill level. I think that's where the focus needs to be.
Thank you so much.
So my question is about the future of the digital therapy platforms. And I have a perspective that could be subjective a bit, but looking at it, especially in therapy sessions, with psychiatrists, psychology, or even life coach. I mean, building rapport or for a session to be efficient, the communication that we're trying to build is not only facial, but it's even body language. And this is something that we need even to observe with the patient. In life coach, for example, as a practitioner, you should avoid eye contact in certain stage. You should give them space to express their body, and these are instruments that we use in sessions. So in that sense, when I hear that, let's leave it to the patient, what they prefer, actually they don't know what's best. We as practitioners, we need to have these, I don't want to say like it's boundaries, but I'm just worried about a complete migration into digital. I know everyone would like to globalize their business, but also catering quality session and therapy, that's actually the efficacy that we want. That's, again, personal perspective, but also as a patient, I would feel maybe more comfortable in person, but
I appreciate what you're saying, and again, you're highlighting the point about comfort level. One of the key things is when you're doing digital, you're using video. So you're able to see the client, and you're able to see their facial expressions, their body language. You're able to do tactile things. For example, if I'm teaching them how to do, what is it called? I can't think of the name. A relaxation exercise, right? Progressive muscle relaxation, for example. I'm able to do that face-to-face as well as the same as I would do it in person when I teach one of my classes at a college. So it really, again, it really depends on your comfort level and also what the concerns the client is coming with. So there are some limitations, but also there are some areas where it's not going to be limitations.
I would like to answer from technology point of view. I think we have a lot of advancement in AI right now to understand the body language, and it can also generate a report. The only problem right now we have is the cost would be higher than human consultation. So that could be advancement later, but now I think in person would be better to understand the body language.
Hi. Thank you very much for this insightful discussion. I'm a psychiatrist, and I've got a question. You've touched upon the information governance and regulation while you're talking, and we know that it's usually in the field of health and medicine. It's becoming very challenging when we are going cross-border because of the regulatory bodies and all the licenses, etc., are different from one country to another. So how do you deal with this challenge? So this is one thing. The other thing, it's just maybe Dr. Abdullah's back, he can advise on that. In terms of the medication prescription or procedure, again, if I'm licensed to practice in Dubai, for example, and I would like my client is in the US or in the UK or wherever, how actually, if I'm prescribing medication for them, it's not going to work. So I just need to get your experience on that.
You are correct about that. You know, there are professional boundaries. So, for example, if I have a client and they're lived in Florida, right, and now they've decided to move to the UK, even though I've got digital, I cannot be their therapist because of practical implications that you're mentioning. So it definitely, when we move and you're out of the jurisdiction of the provider, it definitely affects continuity of care. And there's legal and ethical concerns regarding that.
And I think from my perspective, from the insurance side, we would never work with a partner who doesn't have global accessibility and partnership. And every region across globally, they must be able to provide the medication prescription, right? And then with affiliations, with different partnerships, you could make it work, or then you don't consult that patient in that region. You wouldn't pick up the case if you're not able to take it till the end then.
Okay.
All right.
Yeah.
I worked on a similar platform where we were giving the care across the globe, and we solved this problem providing an authorizer for that country. So they could consult specialists from different country, but their medication should be authorized from the country they are in.
Okay, so so I understand from that. Thank you very much for that. But it means that if we are going to, in terms of digitalization, it doesn't actually go cross-border as we hope for because of all this regulation and restriction about medicine, medication, etc. So I think this much limitation of what we are aiming for. This is my understanding. Thank you.
Yeah,
Thank
I
you
think
so
they
much.
will still work for counseling and everything, coaching, counseling without medication prescribing or treatment.
Could continue, yeah.
No, I mean, therapists, we're tied to our jurisdiction. So if a client moves, unfortunately, we cannot provide the continuity of care because ethically we're binded, even legally we're binded, even though ethically it's important to provide continuity of care. We then, as a result, provide transitional services to our clients, helping them locate a therapist that is in their jurisdiction. So it is a barrier.
All right, thank you so much. We won't be able to take any more questions due to time crunch.
Just last question.
Last question, please. Thank you very much, Cheryl. Appreciate that. Mine is more from healing family trauma and intergenerational connection. Like, I have a session and probably they recommend me that I need to bring someone from my family for us to have the conversation. But given our background, they don't believe in therapy. And they're like, no, this is against my religion, against my values, against who I am. So how do you slowly introduce that conversation to break down these barriers, bust these myths, so that we can all come and heal our family trauma together?
So here's the thing. I would start with the client.
Okay.
What are the things that you can control? What are the things that you can influence? And what are the things that are out of your control? The other people that are important to you might be out of your control. So let's focus on your healing, what's keeping you stuck, and also at the same time, what are the things that can give you peace? So for example, you need to really talk to your mom, right?
Yes.
Your mom is saying, no way, absolutely not, only crazy people go, right? So, for example, one of the things that we could talk about is what are the feelings that you have towards your mom? Let's do an empty chair technique where you write a letter to your mom.
Okay.
Right? What are the things that you would like your mom to do? What are the things that you can say to yourself? We also talk about the process of forgiveness. You know, what are the things that you need to accept about your mom? What are the things that you can let go? How do you adjust to that? Here's the thing, you can't change other people as much as you'd like to, but when you work on the client and having them change the way that they see things and having them use more adaptive coping skills, oddly enough and counterintuitively, everything around them starts changing. And so you're changing the way you show up. As a result, whoever this trauma relative is now going to change the way they respond to you because you're not the same person.
Not the same victim. True. Thank you very much.
Thank you so much. I understand we have a lot of questions, but I believe someone from the panel needs to leave urgently, so she has a flight to catch. That's the reason I was doing a time crunch. No problem. So these panelists would be available around, or else you can get their business cards and contact numbers and be in touch with them. Meanwhile, can we have a quick photograph before you leave? Thank you.